Hello, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm going to answer a very important question that we get asked all the time as chiropractors. Where does low back pain come from? Well, the answer to this question is not that simple, and that's because there are multiple structures in your low back that can cause low back pain if they're not working properly or they're not in the right condition. Now, the thing is these multiple structures all have a common nerve supply. So they all have the same nerve that tells your brain when you have pain, but they're different structures. There's the back portion of your disc that's innervated by this nerve. There's also the facet capsule, and then there's also the deep muscles in the spine. So if you have a sprain to a muscle or strain into a muscle in your deep part of your spine, or if you have an issue with a strain of a facet, that's both going to send the same signal of pain to your head from the same nerve. Now, the only way we could really figure out which specific structure is causing the pain, we would have to take a local anesthetic, similar to that anesthetic that the dentist uses when they numb your tooth, and inject it into each little structure and wait a short while and see if the pain goes away. Now, that's obviously ridiculous. We're not going to do that. As chiropractors, we never inject anything. And it's not really practical. It's kind of a waste of time and a waste of resources. So the only thing that's really important when you ask that question is where is the pain, like why is my low back pain bothering me, is whether or not the pain is staying in your low back here or if it's going down your legs. Now, if you can see here, there's these little nerves that come out of the spine. These nerves actually don't stop at this one's end here. They actually continue down, and some of them go down your leg. A lot of people know of sciatica. Sciatica is a symptom that is irritation of the sciatic nerve. Now, when you have something, we're going to compare facet pain, which is like mechanical low back pain, to nerve root pain, which will radiate down the leg. When you have a facet sprain or injury, what ends up happening is when you flex forward, it feels better. And that's because these are the facet joints, these little joints between the spine, like literally that right there. If you bend forward like this, you're taking a lot of pressure off of those joints. They're actually coming apart. So it feels a lot better. It feels like there's relief there. If you go backward like this, then you're compacting those facet joints. And that's going to cause a lot of pain if that area is injured. Now, if it's a nerve root issue, if you flex forward, this is actually a herniated disc right here, but it's on the posterior side of the spine here. If this was herniated out here, if you could imagine this to be like the front of the spine, and you bend forward to compact that, that's going to cause a lot of pain. So usually people who flex forward when they have a nerve root issue or a herniated disc, it feels really bad. If you go backwards, it actually feels really good because you're taking that pressure off of that area. So that's one way we differentiate exactly what's going on with the low back. Another thing would be that whether or not it's going down your leg. Now, the difference in the diagnosis, whether it's a facet issue or a nerve root issue, is going to change the way that we treat the patient. So when you come in our office, we're going to screen you, we're going to do an exam, we're going to figure out exactly what's causing the pain, whether it's a facet issue or whether it's a nerve root issue, and we will treat you accordingly. We're experts in treating any sort of mechanical low back pain. We're experts in treating any sort of radiating low back pain that goes down to the leg as well. So I hope that helps answering your question. I'm Dr. Will Holdsworth, your Sussex County chiropractor from Pain Relief Chiropractic. Thank you so much for watching.